What's going on? Good evening. How y'all doing out there? Welcome to Urban Renal Talk with Tamika and Steve. I am half your host, Steve Belcher. Again, please keep my partner Tamika in your thoughts and prayers, not just physically, but mentally, spiritually, the whole combination. Please keep her in your thoughts and prayers. Tonight, we definitely got a really good show. We named this show Healthcare Workers and Kidney Disease because we all know that kidney disease affects anybody, but you rarely hear or see healthcare workers with kidney disease unless you know them personally. Me personally, I know several people that I worked with in the past in dialysis that now have kidney disease and undergoing kidney dialysis. So I think this show is really important tonight to share light that healthcare workers, even though they give what they have to help others, they do have to sometimes receive that as well as kidney dialysis patients. Tonight, I have a special guest that I'm blessed to have on the show, or we are to have on the show, Kimberly Hunter Clayton from Jacksonville, Florida. She's sorority Chi Eta Phi. She has her master's. She has her BSN. She has her MBA, nurse practitioner candidate. I mean, we can't get any better. So without further ado, I bring in Kim. How you doing, Kim?
Good evening.
Did I say the name right? Chi Eta Phi.
Yes, you did.
Okay, I don't want your sorority sisters to be on me the next day saying he didn't pronounce it right. So if I did mispronounce it or anybody thought that, my apologies. How's it going, Kim?
It's going wonderful.
That's great. This show has really had some excitement. I've seen a lot of shares, just the anticipation of having you on. And it's great to have you on. How's the weather in Florida?
Actually, it's actually pretty warm today.
Okay, that's great. So, Kim, let's just start right to it. How does your story start with kidney disease? I mean, can you take us back to when you first got diagnosed or heard of it, and what was going on?
Absolutely. It was 2007 when they began noticing that my creatinine levels was starting to slowly rise. And at that time, see, I was actually a LPN at that time. So I also began noticing that I was feeling tired. I didn't have any energy. That was 2007. And being in the healthcare field, we try to tell our physicians things that we want them to try, we want them to do. They respect that to a certain extent. When it got to the point that I wanted to take over my care, I began to tell my nephrologist I wanted to try this. I wanted to try IV diuretics. I wanted to go to the hospital to have these things done. He cautioned me that if we do that, it could throw me into acute renal failure. I never wanted to go on dialysis. I was afraid of dialysis. Even being in the medical field, I was still afraid of being on dialysis just because of the stigma, just because it's so many African Americans on dialysis. So that was the fear of mine. Although I was taking care of patients with dialysis, it was still a fear for me. So at that point, we tried it my way. We went on aggressive IV diuretics. I went to the hospital, was admitted in the hospital for 3 days. The fluid still wasn't coming off. This is November of 2010, Steve. I gained about 35 pounds of just total fluid. I was holding fluid, couldn't get the fluid off me. So we decided to do a second round of IV diuretics. And as you know, and for people who don't know, diuretics is used to pull a fluid off your body and also to lower the blood pressure. I had both issues, blood pressure. I was diagnosed at age 16 with juvenile diabetes. So for me, the journey started way when I was 16 years old with diabetes. 2010, I'm in Baptist Hospital. My nephrologist comes in and says to me that the diuretics didn't work. I was now into acute renal failure, and I had two decisions: either do dialysis or not. My first thought was, I'm not going to do it, honestly. And I have to be transparent and real. I didn't want to do dialysis. I just felt that I was afraid. I was taking care of patients on dialysis and saw what they'd gone through and went through, and it was very hard for me. After about 10 minutes, I began to think about my children, my family, and what I had still left to do. So I chose to go on dialysis. I was placed on hemodialysis at that time. I was going 3 days a week, Monday, Wednesdays, and Fridays, from 6 in the morning to 10 in the morning. So I was dialyzed for 4 hours. For me, Steve, it was more African Americans in that dialysis room than any other race. For me, it was hard. It was depressing. I was still working a full-time job. I would leave dialysis and go right to work. The days I didn't have dialysis, I would try to work 12-hour days, because I felt better. But it was a journey. It was very hard for me. I can't hear you, Steve.
I'm sorry. When you started dialysis, did you start off with a catheter, or did you already have an access put in, knowing that dialysis was pending?
No. Again, I had a porta catheter put in. I did not. They wanted to vein prep me. I declined because ultimately I wanted to do peritoneal. Because again, initially, the hemodialysis, I was tired a lot. I was sick a lot, very nauseated a lot. And again, the things the patients go through when you're on dialysis, honestly. I went through a period of being depressed, and I have to be really honest. And although my faith is very strong, I still had that moment where I felt some depression.
Right. Right.
So, and also, I think for me, being in the dialysis chair, a lady next to me coded and passed away. So that also was very hard for me because, again, in my mind, I wasn't supposed to be here. I later learned that, yes, I was supposed to be there, that's how my destiny had took me to. So I had to learn how to survive being on dialysis. I had to learn how to eat right. I had to learn how to watch my blood pressure. I had to learn how to watch my phosphorus level. All the things they teach you to do that I would teach patients about as a nurse. I was now the one having to receive those instructions. And although you're in the healthcare field, sometimes you turn a deaf ear to when you don't want to hear certain things. And that's what I did for a moment, only a moment.
Right. Right. So let me just ask you this. Last night we had a conversation with Lily Lyles. She's a patient in Hollywood, California, that's advocating strongly for yes to Proposition 8 that's out in California. I'm not sure if you heard of the proposition, but it's a really big push. And the two corporate giants, DaVita and Fresenius, spent a record breaking of the state over $111 million to go against the opposition to vote no. The proposition, I don't know all that entails, but it's basically for the companies to rein in their profits only by 2% and kind of report what they're doing and kind of spend more money centered toward patient care. And this is out California because, these companies had a practice with steering patients to Affordable Care Act insurances in that network, which are private insurance. And that way, instead of Medicare paying the $260, they could charge the insurance companies $2,500 to $5,000 per treatment. What I wanted to ask you, as a patient, as far as being on dialysis and now a healthcare worker, do you, so I don't know, I know you don't know about Proposition 8, but do you believe, based on what I just told you, that Proposition 8 is good for for California, because the opposition is putting out commercials using patients saying, if you vote yes to Proposition 8, I could possibly die because dialysis clinics are closing. Now, I don't. That is absolutely ridiculous to me. No clinic is going to close because people voted on a certain proposition. What are your thoughts?
I think that unfortunately, there are more and more cases of dialysis starting every year. I don't see that there's no way that clinics can actually close down. We don't have that here in Florida, so I'm not really versed on that information just yet. I did see the interview, but I've not done enough research on it as far as to give a really good answer. I do know for sure that, as we know, and you know too, Steve, because you're in Dallas as well too, working, that the clinics would not go away. The funding for hospitals cannot accommodate the amount of people that are being put on dialysis every day. And remember, there are more people that need dialysis in organs than there are organ donors. Okay, so therefore, and everyone is not a candidate to be an organ recipient. So I think we have to know too that everyone is not a candidate to receive an organ.
Absolutely.
So therefore, some patients have to rely on dialysis on their schedule just to survive. And I know that as for me, to be on dialysis, I did peritoneal dialysis, and as you know, for me, I received an organ transplant, a kidney and a pancreas transplant. And again, with type 2 diabetics, I was actually type 1 diabetic. Type 1, my body did not produce insulin. So therefore, a pancreas transplant was the cure for my diabetes. The goal was to transplant both organs because the life of the kidney would sustain longer. So that's why I got the kidney and the pancreas. But again, there's testing that we've done to be a candidate for kidney and the pancreas. And there are not very many pancreas transplants done, as you know, worldwide. They're very rare, very rare.
Absolutely. Absolutely. Now, can you take us back to the day that you found out that you got your transplant, when you got the call? Can you take us to that moment, what you was doing and how that evolved?
Yes, and that's very, very, very emotional for me even now. The first call came on July the 8th, and the call came in and it said that I had a possible donor, that they would know something about in the business that day. So for me, I'm like, I get a call, there's a possible donor. I didn't really understand that, but they said that we'll call later. My sister, Carolyn Hunter, actually had plans to go get tested for me to receive one of her kidneys. She was tested that day. The call came in that night, and they said that the organ they thought they had for me, the person lived. Now, Steve, for me, that was bittersweet because just like my family was praying for me to receive an organ, that person's family was praying for life to be sustained, okay? So for me, when the call came in that I didn't get the organ or the person lived, it was very bittersweet. The next day, I went to work. It was actually a Saturday. I went to work as normal. I got a call about 11 that morning and told me that I had 2 hours to get to Gainesville, Florida, because they had a donor and the organs were being sent to Gainesville from Atlanta, Georgia. I remember dropping the cell phone on the floor because I couldn't believe it. I was on call, so I took the on-call phone to the nursing supervisor, called my daughter, called my son, and they came to pick me up from work. And we tell the story. My daughter drove, and people who live in Florida know that in Gainesville, it used to be known in the area as a high ticket area. Well, my daughter did get a ticket speeding to get me to go get the organs. But that day was very bittersweet for us because, again, just to know that I was having life sustained because someone chose to donate their organs meant a lot to me. 2008, go back, my nephew was killed. My sister made the decision at that time to donate his organs. Little did I know, 2 years later, I'll be the one in position needing organs. Very, 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 very bittersweet. So as you know now, I do education on organ donation, trying to dispel the myths, because again, someone made the decision to share their organs with me.
Hmm. Um, I just want to read a quote that I saw on your Facebook page. You said, "To whom much is given, much is required." What does that mean to you?
Um, for me, because I've gone through a lot and I say a lot, but I know that God puts no more on us than we can bear. I know for me, much has been given to me, so much is required of me to do. There are times that I could have chose to give up. There are times that I could have thrown in the towel. But my faith in God truly allowed me to not give up. There are times that my kids had to give me a bath. There are times that I was too sick to even eat food. My kids had to feed me. And that's very hard being for a parent, because we're supposed to be the caregivers of our children, not vice versa, and not me being as young as I was. So for me, I pulled on my faith a lot. My church family, Household of Faith Church in Jacksonville, very instrumental for me at that time, and still now. So when I say that, and that is my motto: to whom much is given, much is definitely required. I couldn't give up. And as you know, Steve, while going through my journey with transplant, I still went to school. I got my bachelor's degree. I got my master's degree in leadership. I got my master's degree again in business. I got a master's degree in adult gerontology, nurse practitioner. And all this was done while going through my illness, my sickness, my transplant journey. All that was done during that time frame. And then now in school, now working on my doctor's degree.
Wow,
Now, I think,
congratulations. I applaud you. I really do, especially from an LPN
yes,
to what you're
yes.
doing. I mean, you rarely, I mean, there are LPNs who do that, but you rarely see them that go all the way to the doctorate. And each time do I encounter a LPN licensed practical nurse, I encourage them to keep going and just don't stop there. And I really, really applaud you on that. That's absolutely amazing.
And again, why my slogan says, "To whom much is given, much is required." Because again, I knew I had children to take care of, and I knew that I wanted to be in a position to be able to help, help people. So, and nursing is truly my passion. I love what I do. I have no regrets at all of my career choices. And I say that to say this is that when I have patients that are dealing with kidney disease, they come into the clinic and they're have had a bad day at dialysis. I'm able to relate to them. I'm able to say I know how you feel, because I do. A lot of people can't say that they've been on dialysis, that they've been tied to a chair for 4 hours, and you're cold in this in the clinic. You're watching TV and you're tired of eating those crackers over and over again. But I did it. And
Right.
again, God is no respecter of persons. And I say that to say this is that I'm no different than the next person, the next lady, or the next me. I'm not, because we're all equal.
Right. Right.
So my passion is always to have compassion for people. When patients come in and tell me, it's Clayton, I don't feel like I'm just tired today, and I understand. I can empathize with them because they are tired. It's a lot that you have to do being on dialysis, and as you know, Steve, you have to keep your levels in order. You have to watch your salt intake, your phosphorus intake. You have to not do sodas. You
Mm-hmm.
have to, food restrictions. So there are a lot of things. Your whole lifestyle changes. And don't think that getting a transplant, everything is grand, because I don't do dialysis, but I take about 45 pills a day. And that
Wow.
is
You
to,
take
and that,
45?
yes,
Wow.
yes, yes.
Wow.
And I would have to do that for the rest of my life, or as long as I have this kidney, because there are anti-rejection drugs that you have to take. With that comes side effects. Honestly, I think I've gained about 20 pounds since my transplant. You're on so many anti-rejection medications. Um, you have to still watch what you eat. You
Right.
have to, to exercise. So even being having the transplant, I still have to watch lifestyle modifications, and I do that now. I
So,
didn't want to gain those 20 pounds.
but let me ask you this. Some would say would ask why. Well, first of all, how long have you had the transplant?
I was transplanted July the 9th, 2011.
Okay, so some will argue, how come your rejection medicine didn't decrease? And because some, patients who got transplant, they've been taking off certain medicines and they may be down to about 10 or 5. So is yours because of the
Well, I think,
pancreas as well?
well, right. And remember that I had 2 organs. And also with the program, I'm very open and honest. I take program cells that prednisone of the 3 that I take every day.
Right.
I'm on no medications, but just those 3. I take vitamin C and iron pills. But again, remember, my program levels are, my dose is a little higher because I have both organs. The goal is
Okay.
to decrease, but remember they have to titrate based on my levels. So when I go get my testing once a month, they look at my levels to see where it is now. So yes, the goal is to come down some, and I have been down some of less pills, and I had to make adjustments.
Mm-hmm. Okay. Okay.
But I'm totally, when I tell you I'm totally okay with my regimen, I'm good. I am. I'm good.
Great. Great. It was something I was going to ask you, and you was talking, but that's okay. It will come back. So with so do you still have your access, your the site where the peritoneal is, or healed up and closed?
No. After I was transplanted, they actually the day I got my transplant, they removed the peritoneal site that day. So
Okay.
they put a bandage on it, and it healed up eventually. It healed up eventually, and
Okay.
my porta cap was taken out when I a little bit after I started peritoneal dialysis because
Okay.
I was no longer using that access site. So my porta cap was actually in this area here. It was taken out maybe a month or 2 after I started peritoneal dialysis.
Mm-hmm. Okay. So I know I was getting ready to say. So what I just wanted to say to the audience, what they don't know, is this whole interview to me was ordained by God. It was already in God's plan. And the reason why I say that is because you have a sorority sister that I know named Angela Cole. Me and Angela Cole worked in 1997 at Washington Hospital
Wow.
Center, and I had just graduated in 1996 with my associates in nursing.
Wow.
And so I was already working at the BMA, quote Fresenius, but it was BMA at the time, and they had opened, and this was at Washington Hospital Center in DC, and they opened up a satellite unit in a hospital, and I was working there as a tech and going to school, and then I got my license. So Angie came on board, and we kind of alternated doing charge at the satellite, but we became friends from that point. But who would have known back then that I would be right here speaking with you, and you knowing her through, the sorority that you belong to.
Yes.
And even before I met her, if I never did what I did in the past, as far as the certain moves that I made in my life, I wouldn't have even been a nurse. That wasn't my lifelong dream to be a nurse. It kind of just fell on me, and I just kind of ran
Wow.
with it. So I believe this is God's plan.
It
And
is.
yeah, and let me just ask you this: when you was an LPN working, and you knew that you had juvenile diabetes, did you
Mhm.
ever expect to further your education back then, or this is something that you decided when you was dealing with this disease?
I knew that I wanted to go further, but I had many setbacks. Steve, I had many setbacks. From when I was LPN, I had to sit out of school for 2 years. Life changes happened. I sat out of school for 2 years. Then when I went back to RN school, I got very sick in RN school. I was actually intubated into a coma for about 3 weeks. So those were setbacks that caused me to question, was nursing for me? I was getting tired. I want to still stick in this field. And the answer always came back to being yes. So it took me longer than most of my other peers, other my other students. I mean, I started out with one class RN school. I think two classes passed me by, and I was still in RN school. But the Bible says that the first should be last and last should be first. So I didn't use that as a discouragement. I use that as saying God telling me that my time is my time. I can't compare my time with my sister's time or my brother's time and my husband's time. My time was truly my time. So for me, it took me a lot longer that I planned for it to take because of the bumps in the road. But God knew that everything that happened to me, it would happen. He knew that I would have the setbacks. He knew I would go through the kidney failure. He knew that I would lose my first husband to an accident in 2012. So God knew that plan for me, but yet he still allowed me to accomplish goal after goal after goal after goal and still obtaining another goal.
Right, right. That's amazing. What now? Once you get your nurse practitioner, what are your plans?
No, Steve, correction. I'm already a nurse practitioner.
Oh, okay. My apologies. Okay, I thought it was a candidate. Okay,
No,
so
I'm in school getting my doctor's degree.
oh, the DNP.
Yes.
Got you. Got you. Okay, I was going to go for that, but the foundation courses toward in DNP, I couldn't deal with it and work for a time. It was just too much, you know. But anyway,
You can do it.
yeah, but God had a different plan for me. I got my master's in health education and promotion.
Okay.
So, yeah. So, do you still work in dialysis now?
I never worked in dialysis. I took care of patients who are on dialysis who come into the clinic to be seen. Right now, I'm doing pain management. So I would take care of patients that would come in to be seen for their primary care visits, and that's how I would interact with them as well too. And also prior to that, I worked in long-term care, so I also took care of patients who were going to dialysis or coming back. So again, I've always been around dialysis patients, and my passion for them grew after being the one on dialysis. It's one thing to hear people say how they feel, but to be the person that was in the chair, as I said earlier, to be the person, watch your blood being filtered out and back in, to be the person you're so tired when you leave there and then having to drive home. To be that person is different. It makes you appreciate things. It makes you appreciate life. It makes you appreciate your journey. I keep very close contact with people that I knew from dialysis. I mean, that's just my passion. Also, organ donation, it's my passion. So I truly know that God put me through all that to be a voice and to be an advocate and to share my story. And I say that every day is not a good day, but every day has been a better day for me since the day yesterday. So I say it that way. Even to now, I had a patient just a few days ago, and was in office. Was just saying things about being dialysis, and I just began to share with her my story, and it brought her to tears. And she said, "You were on dialysis?" I said, "Yes, ma'am. Yes, ma'am. I was on dialysis. I too, know how to do this." And she couldn't believe it. So she couldn't believe it. But again, I think that people need to realize that healthcare workers, we too go through things. Being a healthcare provider, being an NP does not exempt me from going through things with my health. I still have to go see my nephrologist once every 3 months. I still have to go see my cardiologist. I still have to go see all the specialists that I had in the past, just for routine maintenance visit.
Mm-hmm. Mm-hmm. Let me ask you this.
Yeah.
How important is your sorority sisters during this journey to you?
Oh my goodness. They have been amazing. Absolutely amazing. I'm in the Delta Chi chapter in Jacksonville, but we interact a lot with my other sorority sisters, and they have really been encouraging for me. I've had to call on some of my local sisters here just to lean on the crowd sometimes because there are days that you just get frustrated with things. But I am truly blessed to be in Chi Phi. It's truly a close knit sorority. And I can say nothing but good things about them because they truly have pulled together. And again, our motto is service for humanity. So we're constantly educating the community about what we do. and also being a help to the community. But I absolutely love Chi Eta Phi, hands down.
Wow. Can you share with the audience just a little bit about the organization and um, the occupation that it represents?
Yes, Chi Eta Phi is an organization of professional nurses. There are some states that have a graduate chapter and the beta chapter. In Delta Cacao, we have a graduate chapter. So it means that everyone is a registered nurse. That's one of the requirements. We all have various degree levels in our sorority here in Jacksonville. I attended the conference in Birmingham in March and met a lot more of my sorority sisters. And I think for me, the networking that it brings, just being amidst of so many professional nurses, is mind-boggling because again, we all have a story, different educational backgrounds, but we all have the same motto: search for humanity, to give back to the community, to assist, to help out. And we always try to encourage our sorors, go back to school, get your education, go for your master's. Whatever your degree level is, go higher, get the next one. So we're very passionate about education.
Mm-hmm. Mm-hmm. Okay, I got a question. I got a comment, and I want to know what you think about this comment. This comment is from Kristen McCall, and she says, "I see. She looks like she liked to work in healthcare after her transplant. That would be a negative for me. I would not want to be exposed to everything with being immunocompromised." So what would you say to that?
I think that, and I had this talk with my nephrologist as well too, because he knew my profession, he knew my passion. The first year after my transplant, I kind of was more in one environment. And you also have to realize too that certain germs that when you've been around, you become immune to. And being in long-term care, that was my first year after the transplant. I took my flu vaccines, I took my vaccines, pneumonia vaccine, I took my vitamins. So again, that first year, I was very, very cautious about getting any infections. And even to now, I still get all my vaccines. I've not had an episode in years where I've gotten really sick. But remember, being on immunosuppressants, for me, the common cold can turn into a prolonged cold for weeks and weeks and weeks. So I'm very cautious about my surroundings. I'm very cautious about staying on top of my health, eating right, trying to get more rest. Just things to do that I've learned my body. And I think everyone knows their body and what they can and can't do.
Mm-hmm.
So I think for me, as time went on after my first year, I began knowing what worked for me. I go into certain places, that I knew that when cold season breaks out, I know to be in my close environment. So for me, it's different.
So Kim, wow, so just on the top of my head, I was going to ask you about that. So, how important is your family and during this process?
Absolutely super, 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 super amazing.
Yeah, I had an opportunity to meet your son and husband, and I mean, you even mentioned that your son was feeding you at some time, or you was being fed.
Yes. When I was going through my illness, at the time, my daughter and son would actually take care of me. They would actually literally take care of me, from the point of bathing, iron my clothes, give me food, give me something to drink, because there are days that I just couldn't do it. I just couldn't do it, honestly. But my family is truly a big support system for me. They are, and I start with my parents. I go down. I'm the youngest of 9 siblings. I have 8 other sisters and brothers, and I'm the last one.
Mm-hmm.
My husband, awesome. He does a lot of things for me. My son does things for me, and I have a daughter that's married, but she also, when she can, she comes, she helps. Because again, I think family is so important, and you have to have that support system, because if not, it's a lot that entails that goes on into the recovery phase. A lot has to be done. A lot has to be said about your family to assist you. There are days that I didn't want them seeing me in that condition. I would just come home and go around, close the door, and lock it. Didn't work because they unlocked, so I got to open the door. But sometimes you want to just pull away. I learned in those times I need them the most. I really need them to not allow me to get to one to shell. I'm very comfortable. I'm very happy with the choice that I made, Steve. And I would not change anything about my journey. I used to say, well, Lord, why me? Why am I so compassionate? Why am I going through this? Why am I doing this? But I know for me, it's not calling. It's natural. It comes very natural for me to be the support system I have because I give out so much and I receive so much more in return. So for me, that's priceless. It's peace.
Your son Robert said, "Hey, Ma."
Hey.
Robert.
Hey, Robert.
Yeah. So when you had your transplant, the double transplant, did you wear a mask for like a couple of months?
Yes, absolutely. Absolutely. Even when I would go to appointments, I wore a mask every day, everywhere I went. Because again, you're so fragile in that first period after the transplant that you can't get that. You're just very cautious, and they tell you that certain infections, could prolong your healing. Because remember, you're on immunosuppressive medication. So I like to have no immune system because mine is suppressed to nothing. So for certain people that can take things with your immune system, I can't do that. I can't load up on things to kick mine in because mine will attack my organ. Because remember, the immune system thinks that my organs are foreign objects. So they would try to invade the organs to attack the organs. So they even suppresses all that. So therefore I have no immune system. So I'm very cautious about, again, people I be around, even to my patients. So I stay vaccinated. I stay with my vitamin C, and I've not had an issue. Praise God for that. Praise God for that.
Yeah, absolutely. So let me ask you this, and then I had a question from somebody in the audience. Are your husband and son and daughter organ donors?
Yes, they are.
Okay,
and
great.
they only chose to be that. And honestly, I was not an organ donor prior to being transplanted. I thought about it, but again, I'll say this: the myths are still out there. So I think that, and one of my passions is actually going out to dispel the myths about people not wanting to treat you because you're going to die and they want your organs. But I made the decision. My husband didn't know. My son, he's 17. He was a little leery, honestly. He was a little leery, but he did make the decision also to be organ donors.
Wow. Wow. So we had a question from Christian that wanted to know how long had you had your transplant, but your husband, your son answered it since 2011, correct?
Correct.
So that makes it going on 8 years?
Yes.
Do each year, do you have a anniversary or some type of celebration with you and your family for life?
I do both. Every year at my job, I have lunch catered for the entire staff, and I've done that ever since my first year anniversary, and I do that now. I have lunch catered for the staff because for me, it truly is a celebration of life. I do lunch for them. My family and I, we go celebrate also as well too, because again, for me, it truly is a new beginning for me. And if people, and if you're my Facebook friend, I posted pictures years ago of how sick I used to be, just how tired I was. Because for me, I don't want to ever forget my story, Steve. I don't want to ever forget how sick I was, because for me, it's a reminder of just how good God is. And I don't know, what everyone, religious is or what their faith is. I just know, but for me, what sustained me and what kept me from not giving up and what kept my drive going was my faith in God and my family who supported me and loved me, and my friends and my sorority sisters, who even now pushed me and, encouraged me to go higher, because I wanted to just get this doctorate up. I didn't want to go for it. I'm telling you right now, I was tired of school. I was tired of papers. I want to go travel. I want to see stuff.
So,
but again, it's sacrifices that we make.
We had another comment from Christian. she says, so one of the medications programmed to help you keep your kidney also damage your kidney transplant over long periods of time. And then they ask, what is your regimen or rejection meds?
So I am on program twice a day. I take 12 in the morning, 12 milligrams at night.
Mm-hmm.
So that's 24. That's 24 pills of this program alone.
Okay.
I take Cell. I take Cell 1,000 milligrams twice a day. So I do 1,000 in the morning. I do 1,000 at nighttime.
Mm-hmm.
I'm on prednisone, 30 milligrams. So I do three. I do three of the pills of prednisone. My prednisone is tapered some. I was on as high as 60. And you know, prednisone, it causes you to gain weight. It causes you to have mood swings. It causes you to have so many things. So I'm still on 30 milligrams of prednisone now as well too.
Mm-hmm. Mm-hmm.
And I do a vitamin C, 1,000 milligrams twice a day. I was taking the Bactrim for my first 2 years after the transplant. They've now since weaned me off the Bactrim. But again, I was on that for the first 2 years.
Mm-hmm. Did your doctors or did the transplant doctors, I mean, and you're in the you're a healthcare professional, but did the doctors explain to you the long-term side effects of the anti-rejection med program? Or is that just from studies, or is this actual facts that Christian is saying that this particular drug, even though it's helping you, is also harming you over the long haul?
With part, and again, I researched both anti-rejection meds because again, I tell my patients, whatever you prescribe, you read it. Because again, doctors are licensed to practice medicine. They don't have all the answers. They're licensed to practice medicine because that's their licensing. Mm-hmm. So for me, I researched it. Being on program, you have to go yearly to have a dermatology consult because you are at risk for skin cancer over long-term use. So I do that every year. I go every year to go get my derm consult. Also on program for some African Americans, your skin turns darker. My skin turned a shade darker than what I was from years before. Also, you have to go to have a cardiology consult because again, program does one thing, but also attack other things too. Possibly could. Mm-hmm. So for me, Steve, I keep abreast of those, but I don't focus so much on the negative and the side effects because again, I've gone through dialysis, I've gone through peritoneal, I've gone through hemodialysis. So for me, watching my diet, taking X amount of pills a day, I can do that.
Right.
So right. I don't focus a lot on the what ifs of the medication. I do what I'm told. I do my regimen. I research. I study a lot. Right. And then if I feel myself starting to have a reaction, I'm very prompt to call my nephrologist. I'm very prompt because I know my body. So yeah. And I stay in tune to my body.
And I definitely respect that because what works for one person doesn't work for someone else. Correct. And point in case, we had a guy, great guy, Chef Javon. He's a chef.
Okay.
Up in New York. He was on one of our shows in the past, and he had a transplant.
Okay.
And if I'm correct, he hasn't taken no anti-rejection drugs in 10 years.
Wow.
And
amazing.
What he said, he just went up to the altar and put it on the altar. And he took it for a minute, then he tapered himself off. He gets himself checked. And he said he hasn't taken any anti-rejection meds in 10 years. And like I said, what works for one person may not work for someone else. That's what's so kind of crazy about this.
Wow.
Mm-hmm. So that's why I believe God is in control of everything at the end of the day.
No medicine. Yes, he is.
No medicine. You hear miracles happening. What I wanted to ask you, Kim, have you met any other kidney pancreas recipients?
Actually, when I went to LifeQuest Florida here in Jacksonville, where they're out there in Florida, I met several people. Not as many kidney pancreas dual combinations because again, that's very very rare. I met several kidneys. I met heart. I met lungs. I met eye transplants, but very few kidney pancreas transplants because again, that's not a common procedure that's done a lot of. So I've not met very many of the combination of kidney pancreas.
Hmm. Okay. Um, so what far as your ministry now? I know you say you do advocacy work. Are you with the Kidney Foundation or any type of organization
I
far as
am.
an extension? Can you
I
share
am.
that?
I'm a member of the National Kidney Foundation. I'm also a member of the one here in Florida Kidney Foundation. I'm a member of LifeQuest Florida here in Florida. Also, I was allowed to share my story 2 weeks ago at the Tribute to Life celebration here in Jacksonville. I was able to meet donor families. There's a whole ceremony that's held every year. I was able to be a part of that this year. I was invited to that last year, Steve, um, but unfortunately, my nephew was killed last year. And during the time that I was scheduled to be a guest speaker, we had to go to bury him. So they invited me back again this year. So I'm also part of that as well.
Mm-hmm. Mm-hmm.
And
My
so my
condolences.
passion, thank you. And my passion again, as I said, is not just about organ donation. It's also about educating on the effects of kidney disease. And it's more African Americans with kidney disease in other race. It's more of us on dialysis in other race. That's the problem.
Right.
That's the problem.
Right. So Kim, you said you do work for the National Kidney Foundation.
Yes.
Okay, so I just want to read something to you, and I just want to get your thoughts on this.
No problem.
So this is from the National Kidney Foundation, Southern California and Southern Nevada region. Okay,
Hmm.
and this is looking at this on my Facebook page. So it's a post from them about Proposition 8. So it says, and this is from the National Kidney Foundation, Southern California, Southern Nevada region. It says hashtag Prop 8 could be disastrous for underserved communities, potentially causing hashtag dialysis clinics in low income areas to shut down. Prop 8 has had a few names, but we think this is more accurate. This is November 6th. Vote no. Vote hashtag no Prop 8. And the name that they said on this post, it says the Leave Behind Low Income Patients Act. That's how they
Wow.
described it. Now, hearing what I just said, and this is from the National Kidney Foundation in Southern California, saying no, it could be this drastic. And the common theme that I read in this post is low income, low income. Kim, what's going on? I mean, why is it? Why are they pointing the? I mean, I know you don't know, but that's disturbing to say that if you vote yes for Prop 8, it could be disastrous for low income communities because clinics could shut down. Do they mean that can happen because most patients in low income are Medicare, Medicaid patients, and that the clinics can afford to probably close some of those clinics down?
See, let's be honest. Most patients on dialysis are Medicare patients, and as you know, once you get end-stage renal disease, that's automatic qualifier for Medicare as well too. So most of the funding for most clinics comes from Medicare and Medicaid.
Mm-hmm. Mm-hmm. Yeah, but I just thought that was disturbing. They call it the Leave Behind Low Income Act. Why would
Again,
you even, you know, equate low income to a proposition? or low income community. You know, Prop A could be disastrous for underserved communities, potentially causing dialysis clinics in low income areas to shut down. I mean, why not in middle class communities? Why not in rich communities? Why it has to be underserved, low income, Kim? And this is from the Kidney Foundation.
I think that, let me say this correctly. For me, Steve, because we've not been hit with that proposition in Florida, I've not read a whole lot on it, and I can't give an intelligent answer because I'm not very versed with the amendment that they're trying to pass.
Mm-hmm.
So I do need to read more on that to see before I can give a really good answer.
No, and Kim, trust me, I definitely hear what you're saying. I just wanted to kind of get from a healthcare perspective and reading certain tag words in here, like be disastrous for underserved communities, potentially causing dialysis clinics in low income
Well, and I
areas.
think that's why people that are on dialysis need to know the laws. They need to be diverse in what's trying to pass. And not just that, I think that whenever a state trying to pass something, find out the reason why. Go dig deep. Again, that's why it's so important that we need to vote because again, no vote, no vote, no vote, no voice. So I think that they need to research more further to see exactly what it means. Ask questions. Go to your local councilman. Ask questions because again, a lot of us, and I keep saying us because I too am African American. We don't read enough. We want to sign and go. We don't take time to read and read for understanding and clarity. We read to skim through and go. We need to read, understand, and not just read social media. We need to be educated and be in tune what's going on.
What would you say to the person who can't read or who is not educated and that falls victim of this disease? How could we help those individuals?
I think that it goes back to them having a good rapport with their family, social workers, people in the community, and not afraid to ask questions. You know, a person that can't read or write, ask questions so you understand what's going on. And that's why it's so. And see, remember now, don't get me wrong. There are patients that have no support system. I have patients that have no families. It's just them. So those people will fall victim if they don't know what's going on with their care, what's going on with their dialysis, with their patient care.
Right.
So that's why, again, we need social workers, physicians, case managers. It's actually a team effort to get the patient what they need, honestly. It's a team effort.
I agree. So we're basically running down the time, but what I would like to know, what words of encouragement or advice could you give someone who may be in a situation that you were once in that may need a kidney pancreas transplant or even a kidney transplant that may be a nursing student? As a matter of fact, I can't remember her name, but I did meet someone on social media that was a nursing student and dealing with dialysis as well.
Oh, wow.
What words of encouragement or advice could you leave with someone who may be watching this broadcast or may come across this broadcast in the future and see you speaking? What could you leave them?
I say to stay in tune to your health. Ask questions. Learn your body. Find out how you feel. You know, if you notice that you're tired, if you notice that your iron levels are low, first of all, go to your physician. And see, one thing that we don't do a lot of, some people, is go to the doctor. You know, go find out what's going on with your body. What's going on with your body. For me, being in healthcare, I was always asking questions. I was always want to know what is this. Also, sometimes you can be too weak to ask questions. Get you a support system. Get you a buddy. Take you a family member over there with you. For me, it was an option to get discouraged and stay discouraged. And I know sometimes that's easier said than done. But I definitely would say stay encouraged. I would say to find out your options and make sure that if they try to put you on dialysis, that that's the last resort. Because again, I've had patients that's come in and want to know, can I get a second opinion? Absolutely, get a second opinion. This is your life. This is your body. This is your life. Don't take one opinion. Get multiple if you need to. The goal is to do what's best for you. I think also that patients who are on dialysis or going on dialysis, then find out what you can and can't do as far as your diet. Find out your options about getting a transplant. Find out is people in your family organ donors. So stay educated, stay well versed in these things.
Hmm. Wow. Yeah, I agree. I agree.
And also ask questions. Also, people who've been on dialysis, ask them. So, what are you going through? Or how can I avoid going on dialysis? And there are things that we can do to avoid dialysis. Eat better. Keep our blood sugars in line. Things that we can do before it even gets to kidney disease, honestly.
Hmm. Hmm. Just a quick question. Did you go through the stages of kidney disease, or it just kind of fell on you um, like really quick? Did you have an opportunity to try to, um, you know, to halt the progression?
2007, I first began going into kidney failure, and I didn't tell anybody. I knew it. I didn't tell anybody, my parents, nobody. I just began to watch my numbers a lot. They told me in 2007 I'll be on dialysis within 6 months. Mm-mm. I began to change my diet around. I began to eat better, cut out salt, things that I knew that, cut out phosphorus foods, things that I knew that I could do personally, I could do just to slow down the progression of the kidney disease. When I found out I was in stage 2 already. So from 2007 to 2010, I went from stage 2 to stage 4 kidney disease to wound up having end stage.
Mm. So it is important once you find out, know your numbers, to modify your diet, like reduce your sodium intake,
Yes,
reduce your
absolutely.
protein intake, and
Absolutely.
drink more water, exercise.
Absolutely.
Hmm.
Absolutely. So those things that I had to begin to change to do. And also see, remember, even when you go on the list to be a transplant patient, they check you very thoroughly. You cannot come in there with your phosphorus elevated. You cannot come in there with alcohol in your system. So there's certain things they look for to make sure that you're a candidate for an organ, because again, there are people who need organs. They're not going to give an organ to a person that can't follow the simple restrictions, because again, there are people out there who need organs. So I had to cut my diet. I had to lose weight. I had to watch my blood pressure couldn't be up. Watch my glucose level just to remain on the kidney transplant list. I think people don't understand that it's more than just going on the list. You have to follow the guidelines they set for you. If not, then you won't be on the list.
Absolutely. I mean, that's important. I mean, it's no joke. If you're gonna go on the kidney transplant list, you better exactly adhere to what they said, because if you don't, they'll just pass you up and go to the next
Correct.
person who,
Correct. And
you
then
know.
you understand why, though, right? Because there's so many people who need organs than
Hmm.
if you're not considering before you get the organ, there's no guarantee that when you get the organ, you're going to be consistent. Follow your labs, go do follow appointments. And people need organs every day. And again, we keep saying there are more people that need organs than there are available organs out there. So that's why organ donation is so important. People to understand exactly and dispel the myths about organ donation, to know the ins, the outs, the do's, and the don'ts. Because again, I think that some people are not as versed in organ transplants as they should be. I'll say that, or even if they want to be. And sometimes it's scared to talk about it, and we don't want to face death. See, I can remember being told that I would die before I was 40 years old because I would be into full kidney failure and pass away with kidney failure.
Wow.
They told me that I could die waiting for a transplant. And I get it. I understand. Doctors have to tell you the worst case scenario. They have to give you all all the ins and outs, because again, they have to tell you, and then you can decipher which one to do next. But for me, it was never giving up. I did not believe that God would allow me to go through all this, and I'd be able to share my story. And I'm so grateful. I'm so honored. I'm so humble to have opportunity to share and to speak. And all of that, Steve, my donor family lost their daughter at age 20 years old. I was able to receive those organs. So for me, I'm grateful, and I said at the time I will continue to do the things that my daughter couldn't do. She was in college. That's very much all that I knew about her. She was in college. She was 20 years old, and then graduated from college because of what happened. So for me, I'm very passionate about educating and staying connected with the community. And I thank you for just hearing my story, allow me to share as a healthcare worker, provider, what I see, how I can relate to people that also have had this disease, that have this disease, have gone through dialysis, that are waiting for organs. And again, don't give up.
Wow. Wow. Anybody that you want to send a shout out to? I know you have a lot of sorority sisters and friends and family. Please, you can take your time, or anybody, even the donors family. Well, let me ask you, have you met the donor family?
I have not. Through UF Gainesville, there's a process that we go through that you have to communicate through a third party through the hospital. I share things about what I'm doing in life and my career goals and what I've done. I share those things through the secure portal. And if they want to meet each other or vice versa, we have to go through with the third person, and that's how we connect. So as for me, I send things in. They respond, and tell me thank you, but I've not actually physically met them. No, but my goal is one day to meet them. But for them, it's very still hard. Even now, it's still hard for them. But I do like to meet them one day. So definitely, I want to give a shout out to them. My family, who's always been so supportive of me, always so supportive of me. Going to school, getting this last and final terminal degree, they've been supportive of doing that as well. My coworkers who always encourage me and always push me, Dr. Geiger, Maya, all of them, my children, my husband, my parents, my kind of five sorority sisters, my bestie, Monica Johnson, Robin. I just have just such a positive circle of friends. Carolyn, that are really good to me. My sister, Lakeisha Walker Marine. I just have so many people, honestly, that have been with me on this journey, and they're still with me on this journey. And it's so important to keep a good, close-knit family, people that you can lean on, depend on, cry on if you gotta cry, to push you, to encourage you, to motivate you, and also to tell you when you're slacking. Because I'm not. I have flaws. I just pray, that God continue to allow me to share my story. That He continues to allow me to be, take care of patients. That He continues to allow me to perfect my gift, my craft, and also my goal is to open up a practice. That is a goal of mine. Here in Florida. Gotta still help me work out the vision. So I don't want to spill the beans just yet. But again, I believe that will come to pass. And I'm just so
Wow,
grateful.
that's
I'm so
amazing.
honored.
That's amazing. From LPN to ready, to want to open up your practice, and you're pretty much almost at that point in God's plan. That is really amazing. And hopefully somebody who may be a LPN watching, or, registered nurse who
Stay
thinking
encouraged.
about, getting their advanced degree, that your story, even, doing that in the midst of battling kidney disease and a double transplant, going to school and accomplishing all that you accomplished, that's truly nothing but the grace of God. Wow.
I truly say that God gets all the glory. I don't know if I recognize my bishop, Louis Williams, the House of Faith Church, my first lady, but I truly am blessed and honored. And again, I say God gets all the glory, because again, without Him, there's no me. So I'm just so again honored, and thank you for letting me share my story. I pray that it has helped somebody to stay encouraged. I pray that I said something that's encouraged someone. I pray that me being transparent allowed you to see that I'm an open book. I mean, I'm very open about my life. I'm very open about the things I've gone through. If it can help somebody, then I'm very open to share that because again, someone did it for me. And I just truly thank God for my family. And Steve, I thank God for you, just put this out there and getting this show started because people need to hear the story that and they need to know that we're not alone. That this world of kidney disease, that you're not alone. That there are people out there to support you, and you're doing an awesome job really getting it out there and sharing to the community through your program, through your talk show, you and Tamika. I mean, God bless you, both of you.
Thank you. I appreciate that. We appreciate it. We're just trying to, get that message out there from my point of view as healthcare workers, because it's really no, people in dialysis that's really sounded an alarm. I mean, they may be, but I don't hear them as vocal as me and Tamika are.
I don't either.
It's necessary. The truth is the truth. I mean, especially when you got people's lives in your hand.
Steve, keep it up. Don't stop. This is your passion. This is your passion. I look forward to meeting you one day along with my family. So if you're ever in Jacksonville, Florida area, definitely hit us up because we would love to meet you in person. I just really.
Oh, I will, most definitely. I want to meet you and Nashonda, and I plan on coming down to that area in God's time. I will be there.
She's doing such great work for the community. I did meet Japan Rittenhouse of Life Quest, Florida. They're doing an amazing job getting awareness out for organ donation. Honestly, I mean,
we have
it's really a team effort. So again, I thank you. We thank you.
All right, and thank you for coming on. I mean, even thank you for answering my Facebook, request, and friending me, and then answering the post, because I thought seeing your story was very important. That should be told, and just seeing your work and everything that you're doing down in Jacksonville, I just wanted it to be broadcast so other people could see that if you are a healthcare worker and you are dealing with kidney disease,
correct. Yes,
and make it and keep and stay in front of it, because you're a perfect example of it.
Amazing. Thank you so very much.
All right, Kim. So we'll be in contact. I'll shoot you my number so we can stay in contact, even on social media. But I will be down in Florida soon. I don't know how soon, but it'll be soon.
Okay. Thank you so much. I really appreciate it.
All right. Take care. Tell your husband and son it was a pleasure meeting them. I look forward to meeting them again one day.
Absolutely. Thank you so much.
All right. Take care, Kim. Good night.
You too. Good night.
All right. So, yes, we had the amazing Kim Hunter Clayton on tonight. On Sunday Morning Transplant Coffee Talk, we're going to have Barb Lundberg from Pennsylvania on. That's going to be a good show. Next week on Urban Renal Talk with Tamika and Steve, we're going to have Melissa Peed, and that should be a good show as well. So thanks y'all for watching. Hope you learned something from Kim sharing the story that this disease can affect anyone at any time. It doesn't matter if you're rich, black, white, poor. It can affect you. It's just unfortunate that it affects blacks more than any other race. However, it affects all races, but underserved. And you saw the post that I read to Kim about the Kidney Foundation out in Southern California and Nevada. I don't know why they use tag words as if you vote yes for Proposition 8, that it could be disastrous for underserved communities and low income. When you have organizations like that mentioning words like that, it almost kind of had to keep you thinking, why are you using those type of words to describe a proposition? So thanks for watching. Tune in Sunday morning, this Sunday, November the 4th, 11 a.m. Eastern Standard Time, USA, Sunday Morning Transplant Coffee Talk. We're going to have Bob Lumberg from Pennsylvania. Everybody, thanks for watching. We appreciate it. Share this post. Please share. And other than that, be aware, get tested, because the life you save may be your own. Good night. God bless. Peace.